for as long as up to about 12 hours. Same way with adenosine. We know that adenosine is out of the body in 60 seconds or less, okay? But the action that we're looking for, slowing that heart rate down, may last forever, okay? So it's turned off the SA node to keep it from firing so very, very high. Now, the onset, the peak, and the duration are affected by several different factors. One is its bioavailability. Now, that was a word from last week. What does bioavailability mean? Evan, do you remember it?
Is it something that you have the ability in your own body or your own genes?
Tell me more.
I was just
Okay.
I was breaking the word up.
Okay. So bio obviously means biology. Availability means in or available for use. And so basically it means how easily the active ingredient in the medicine, because remember, the medicines that we take have a lot of other stuff in it for transport, for holding it together, maybe for flavoring, maybe for coloring, that none of that has anything at all to do with the action. But the bioavailability is the amount of the medicine that is available for the body to utilize, and that amount is absorbed into the body itself. The other thing that comes into play here as far as bioavailability or onset, peak, and duration is, again, how is the medicine delivered? We know that the onset is going to be the slowest when we take medicine by mouth. Okay? It's going to be the fastest when we take medicine by IV, but there is another route by which it will be almost as fast as IV. Which one is it?
Intraosseous? IO?
That still is IV. An IO would that's a good point, but an IO is still considered venous access. Colin. That's actually going to be more almost like IV because of the amount of blood vessels. The exact same thing. It sounds kind of gross. I see your hands, guys. That's awesome. Thank you. The exact same thing happens in your mouth. Okay, so I tell you, it sounds kind of gross. But I mean, and occasionally, and we don't do this much anymore with rectal medicines because. And generally what we've done with rectal meds is we've given it to infants when we couldn't get an IV on them and they're seizing. Well, now we can get an IV on them because we'll drill an IO. But rectal administration is still part of it. Miriam, did you have your hand up? What? Go ahead.
I was going to say
Nasal, again, it's going into the mucous membrane, but you're getting much, much closer. Claire. Well, that's the intranasal. So that, again, inside your nose, not just a warm, nice, moist place to make boogers, okay? It's very vascular, and it can get picked up just like it can buccal is how it's called in the mouth, or rectal.
I'm guessing in the eyes.
Inhaling. Why? Because we got these alveoli, okay? Remember, the alveoli is where gas exchange takes place. Around the alveoli, we've got hundreds and hundreds, Haley, of capillaries. That's where the gas exchanges out of and into, okay? So when a person inhales something, not always, and not as fast as IV, but it goes into the system almost as fast as if you had given it IV. This is why albuterol works so well. This is why racemic epinephrine works so well. This is why some of the steroids that are out there that asthmatics take to help keep them from having asthma attacks work so well. Hey. Narcan is a good example, but now remember, it's not going into the lungs. Again, it's getting picked up right here at the mucous membranes. So again, these are all things that you got to remember about onset, peak, and duration. We take it by mouth. Onset's going to be slower. Duration is going to be longer than if we give a patient an IV med. Okay, it's going to get burned up much quicker. Right? And so that's the kind of thing to keep in mind. Let's just say, oh, we already covered half-life. Again, how many half-lives does it take to get to for the medicine to be considered to be out of the body? 5. 97% of a medicine is out of the body after 5 half-lives, and that's where we consider that it's been eliminated. Martina.
So when you say 10 seconds, then you count, was that 50, and so that's half of it? Or how's that work? Like, I'm still...
So a 10-second half-life, let's do it this way. So we got a Denison. It's got a 10-second half-life, okay? So we would just simply multiply that by half, and after 50 seconds, it's considered to be out of the body, okay? And again, like we talked about amiodarone's got like a half-life of 72, 75 hours. You would multiply that, and now we're looking at days or potentially weeks that it would be in the bloodstream. All right. Any questions on this as I change over to the next slide deck? Good discussion, guys. I appreciate it. All right, give me just a second here. All right, so we're going to continue. Now, next week, I know you guys are all excited about this. Next week, we're going to do medical math. What's that? Well, the good news is your instructor doesn't like math either. Okay, so I am not a math major. In my doctoral program, the only C I got was in statistics, and it was the most beautiful C I'd ever seen in my entire life.
Nice.
Yeah, I was happy with it, so just meant that I didn't have to repeat it. So what I'm going to do is, again, next week I will show you how I do medical math, but unlike nursing programs that say you have to do it my way or the highway, Devin, if you can show me another way to calculate things and it makes sense and I can understand it, I'm okay with that. I really am okay with it. Okay, so again, with this lesson, what we're going to do is we're going to look at a little bit as far as the historical connotations. Why is my slide not moving? There we go. So, some of the historical considerations of pharmacology. Now, pharmacology goes back as far as there have been human beings. Now, we do have written records of being written all the way back to early Egyptian times. Now, one of the nice things, if we look at that particular within Egypt, the Middle East, and the Greeks, they passed these formulas down from generation to generation. And first of all, they did it by word of mouth, and then they began to put them down in written format so that they were recorded in what are known as today pharmacopoeias. Pharmacopoeia is just a name for a record of medications. Again, if you have not downloaded it, I strongly suggest that you download the Hippocrates app. Won't cost you anything. But that has all of the medicines that are allowed to be prescribed by the United States Pharmacopoeia. If you look at a medicine today, many times you will see the initials USP after it. That means that it is a legal medicine that is within the United States Pharmacopoeia, and the United States government says this can be given. Each country has their own pharmacopoeia. Canada has some drugs that they can give that we can't. Same way in Europe, same way in the Middle East, wherever you go. there are variations of that that's going to come about. Now, after the Renaissance, physicians began to take a little more of a scientific approach. Now, keep in mind, it wasn't too terribly scientific because that's also within that time frame that they began to use bleeding and leeches for healing. Although physicians still use leeches today to help to increase blood flow to areas that don't heal. We don't do bleeding anymore. Remember, anybody know what killed George Washington? Say it again. Yeah, they bled him to death. And why did they bleed him?
To get rid of toxins in the body.
Yeah, but what was his chief complaint?
Yeah.
He had a cold. He had a cold. They bled the man to death. So, anyway. So, again, keep in mind, like I think I shared with you. If I haven't, I'll tell it to you now. I mean, probably 25% of what I'm teaching you right now, if you do that in 5 years, you're going to probably go to jail. The difference is I don't know which 25% yet, okay, because of research. All right, so that's kind of the thing you want to kind of keep in mind as you're going through there. During the 17th and 18th centuries, now pharmacology got really, really interesting because they began to use opium, cocoa, and digitalis, okay? Opium was utilized for just about everything, okay? You can imagine, all right? Cocoa was utilized when I say cocoa, I'm not talking about hot chocolate, okay? It was literally utilized for energy, particularly for warriors on the battlefield. And then they began experimenting with digitalis. Now, you've already heard me talk about how dangerous digitalis is. They had no way of measuring the amount of digitalis that was in the body. They just thought it was, hey, it's an herbal medicine because it was being grown by a flower called the foxglove. And so it's not telling how many patients it helped or if it hurt. Now, in 1796, with a physician by the name of Edward Jenner, he developed a vaccination for smallpox. And that began to become under control as far as we're moving forward. In the 19th century, the 1800s, folks. No, I was not alive during the 1800s, Landon. I saw that look.
You're right, it's dinosaurs.
Anyway, they began to develop some drugs that we're still using today. Atropine, codeine, morphine were all developed back in the mid-1800s, just in time for the Civil War in America. And in many situations, they would use, also ether was developed. Sometimes they had ether when they would do it. Primarily the treatment during the Civil War for injuries was, that's right, amputation, because it was kind of, you either amputated it or you died from gangrene, from infection. Say it again?
I said you don't need it.
You're right. So basically they would give them a bunch of alcohol and something to bite down on, but then ether came along and it was an improvement in things that come along. Now, the discovery of animal insulin was just a really, really game changer in the early 20th century. Now, how do you think that they identified whether a person was a diabetic, though? They what?
They tasted the blood or
Not the blood.
urine. I'm sorry, urine. Oh.
That's some doctor dedication, I'll tell you right there. They would taste the urine. If the urine was sweet, you were a diabetic, okay? And so they began treating that with insulin that they pulled off from, that they manufactured from the pancreas cells of different animals. And now we began to see the importance of washing of your hands and medical advances along like that. Now, we're in the 21st century, and medicines are just being expansively creative, much, much quicker than what we have in the past. But in some situations, they're still really, really slow. We're using a particular type of manufacturing process called rDNA, recombinant DNA, to literally build medications from DNA that go in and turn on switches and turn off switches within the body that really, really does help people. Now, more terms that you need to be familiar with. First word is I can't even say it, pharmacognosy. Pharmacognosy is referred to as the study of natural, not herbal, but of natural drug sources such as plants, animals, or minerals. These are not medications that are derived from the rDNA type of process. Yes?
Can you list the examples again?
Plant, animal, or mineral. Kind of like the game. Plant, animal, or mineral. All right? And so we'll talk more about those specific ones just a little bit later on. Now, today we have a lot of chemicals within the lab that allow them to increase the number of medication sources. Early on, when insulin was first produced, it was basically how many pigs could we slaughter to get the pancreas out to make that insulin. And so now it's very rare that you're going to have any type of insulin that's going to be made from an animal. It's made within the lab. What's that? It's synthetic now. Yeah, you're exactly right. Now, some of the medicines that are synthetic that used to be made from human type of materials or animal types of materials are oral contraceptives, okay? So they affect hormone levels of primarily the female. They're experimented a little bit with contraceptives for men, but they really haven't been very successful within that. But now those contraceptives are developed, again, from a synthetic process. As we're looking at where these come from, understand that plants are probably going to be the oldest medicine that we have. If you have a headache, you can eat 5 almonds, and the same active ingredient that is in aspirin, acetylsalicylic acid, is present at the same dose in 5 almonds. So literally, it was kind of like, okay, they began. But the thing is, it's really interesting because they had no scientific method like we do today, no scientific controls. So it was literally going to be hit and miss, okay, as far as what's coming along there. So the earliest concoctions that we probably see were concoctions made from the leaves, the branches, the roots, as well as the seeds of these particular types of plants. Somebody ate them, they noticed an effect, and they said, well, let me try that again and see if it can be repeated. Early forms of the scientific method are being able to that. Now, keep in mind, some of these were not really, really good for your patient. Again, you can go back to the foxglove plant. They probably made some type of a tea out of the foxglove plant for patients who were in heart failure. It helped to a certain degree until it got beyond that therapeutic window because there was no way of knowing what it was, and DIG has a very narrow therapeutic window to begin with, and as a result of that, a lot of patients died, a lot of patients suffered. That's why it's so hard to get drugs through today. As we're looking at this, and then as they studied the plants more and more, and when they began to record types of effects that came about from the plants, then early scientists got a lot better about taking and saying, this part we can utilize, but this part is going to be poisonous. We can't use that anymore. As we're looking at that, it's very, very important to recognize that this still happens today, okay? There are a lot of people who focus primarily on herbal medications or herbal plants for their medication. But here's the thing, guys. When you're doing your assessment on your patients, and you're getting your history and you're getting your medical history, it's important that you find out from your patient, are you taking prescription medications? Are you taking non-prescription over-the-counter medications? And are you taking any herbal remedies? Okay, herbal remedies. Why? Because these do have certain effects. And most people, because it's herbal, doesn't mean that there's anything that can hurt them. Give you an example. Let's say you got a patient that has a long-term history of depression, and they're taking, let's say, Prozac as an antidepressant, and they read an article that says, hey, St. John's wort, an herbal medicine, is good for depression. There's some research that shows that it is. So they start taking both their Prozac and the St. John's wort, and now we get into a particular syndrome of where the patient's heart rate goes up, their temperature goes up, their blood pressure goes up, because this syndrome is called serotonin syndrome. What it's doing is it's releasing floods and floods of serotonin throughout the body. And this is one of the reasons why when you're looking at these patients, Bannon, and you're getting this information from them, it is critical that you ask them about those three types of medicine so that you can figure that in. Another good thing about Hippocrates is that it will help you with these herbal medicines as well. Animal sources, obviously, we know that we've utilized animal sources for a number of years. We can pull out, early in the 1800s, they began manufacturing insulin from pig pancreases to go in there. And so different organs of the body, and this is just some examples that I found as far as different types of medicine that can be made from organs of the body. And generally what we're looking at is whatever it is needs to be crushed up and refined. For example, cod liver oil coming from the cod fish, that is a medicine that is really, really high in antioxidants, okay? And so patients still will take that. Enzymes that can be produced by the living cells of animals that can be given to your patients. One of the things that we can see that's coming up is that, they did a heart transplant. No, kidney transplant. Kidney transplant on a man who he didn't qualify for the transplant list. He was very non-compliant with his medicines. He wouldn't do what they wanted him to do. But they talked to him and asked him if he would take a pig kidney to see what would happen. Huh?
Pretty sure it was a pig's heart.
Yeah, it was the kidneys actually, because I remember. So it was a kidney, and he lived for about a week. And they did some DNA manufacturing with it, turned some things off. Still a long way from that, but in the past, now not so much. They've actually used the valves from within a pig's heart to implant in human hearts. Now those can be pretty much 3D printed, and so you don't have to worry about those anymore. Two of the things that we want to talk about, and then we'll stop there. Number one is from animals was insulin. The other one is oxytocin. Oxytocin, it's spelled OXYTOCIN. Oxytocin. Two purposes of oxytocin. Oxytocin is secreted in the brain. It's a feel-good hormone. Okay, just like dopamine. All right, it is often it's called the love hormone because it makes you feel loved and accepted. The other thing that it does is that in the female, it causes contraction that leads to delivery of the baby. We'll talk more about oxytocin when we talk about OB med. So, hey.
Does your brain excrete oxytocin when you're like hugged or something?
Yep. Yeah. So, and that's one of the things that literally, people say a hug is good medicine. Well, for a lot of people, it really is because, again, when you are hugging, when you are hugged by someone that you want to be hugged by, if it's by somebody you don't want to be hugged by, Claire, it's just creepy. And it could be criminal, okay? But the bottom line there is you're exactly right. It will secrete that and it will make you feel good, okay? And that's where we're going to stop for today.